Good afternoon, everyone, and welcome to our webinar today on accelerating digitised healthcare. My name is Richard Evans from Barhead Solutions, and I'll be your host today. Just starting off with logistics. First of all, we are recording this webinar, so it will be available on the Barhead website in the coming days. That's always a popular question, so don't worry, everyone. We are recording this. If you can stay on mute during the session so we can avoid background noise, that would be appreciated. We will come back at the end of the webinar for Q&A. If you have questions as we go, please enter them in the chat and we will be circling back to those at the end, or when we get to Q&A, you'll be able to raise your virtual hand in the session and come on and ask your question. Feel free to use the Teams feedback mechanisms during the presentation as well if you like. All right, let's get going. So my name is Richard Evans from Barhead Solutions. I'm the Health Account Director here at Barhead. I'll be your host today. So welcome everyone and thanks for joining. I'm delighted to be joined by our partners Microsoft at this event. And joining us today from Microsoft, we have Mel Taniora-Green and Taniora-Green. Thanks for joining us. Mel is a business applications specialist at Microsoft, focuses specifically on the health sector. Helping organisations drive positive change through technology adoption. And Taniora is a health account executive working with many organisations in the health sector as they adopt the Microsoft technology to improve their delivery of care. Taniora, did you want to say hello from the Microsoft team?
Yes, thanks, Richard. Hello, everyone. I'm the Microsoft account executive for Health and Pharma. And as Richard mentioned, I, along with my wonderful team, help health providers, pharma companies transform by leveraging the awesome technologies of Microsoft and help these customers evolve their patients and members' journey. I will now hand over to Mel.
So I'll just before you go, Mel, I'll just introduce Lisa, and then I'll hand back to yourself. So just with us from Barhead as well is my colleague Lisa Crosbie. Lisa is Barhead's Microsoft Business Applications MVP and Technology Evangelist for Dynamics 365 and the Power Platform. Lisa leads our program of training and events and plays a big part in helping our customers to make the most out of Microsoft Business Applications. Lisa will be taking us through some content later on.
Thanks, Richard. Looking forward to showing you a demo of the Microsoft Cloud for healthcare later. So Mel's going to kick us off before we get to that.
And sorry, Mel, yes, back to yourself. You can introduce yourself and then I'll go back to the agenda.
Thanks for that. So lovely to see so many familiar faces in the audience today. So thank you for taking the time to be able to join us. I'm part of the healthcare team with Taniora, specifically looking after a number of organisations in Australia from an applications perspective and an industry specialist from a healthcare perspective. So looking forward to actually talking you through some of the high-level overview of the solution firstly before handing over to Lisa.
Fantastic. Yeah, thanks, Mel. So we've got some great content to take you through this afternoon as we showcase the Microsoft Cloud for healthcare. So I'll hand back shortly to Mel, but just to give you a heads up on the agenda for this afternoon. So first of all, as I say, Mel will take us through the Microsoft Cloud for healthcare, an introduction to that. Talking a little bit about some of the challenges faced in healthcare today, what the Microsoft Cloud for Healthcare is all about and why it was created, and a little bit about the roadmap of where Microsoft will take the Microsoft Cloud for Healthcare. After that, Lisa will take over and take us through a demonstration of some of the functionality of the healthcare cloud. So we're looking forward to that after Mel. And then, as I say, at the end, we'll circle back for Q&A. So do put your questions in the chat as we go, or you will be able to raise your virtual hand at the end there, and we can come to you for a question. All right, so I think it's time to get going, Mel. So I'll hand over to yourself to take us through the Microsoft Cloud for Healthcare.
Thanks for that. And I think I now have control.
I believe you do.
So welcome again, everybody. Really excited to be able to talk about Microsoft Cloud for Healthcare having become available in the Australian market just last month after launching worldwide this time last year, which Taruna and I were very excited to see. What I'm going to walk through is probably just a little bit of I guess you could say, context setting in terms of why we're here. Now, is it coming through in some of the screens there? You can see some of the imagery there. But what this is really sort of setting the scene on, last year we ran a session with the AFR where Dr. Mezco from the Medical Futurist actually joined us and provided some quite thought-provoking commentary. For example, talking back to inventions that we've had in the past, such as the stethoscope, and how opposed it was when it was originally brought into the care forum. And when you think today, it is such a fundamental and iconic representation of health today. So it really gives us some food for thought, thinking about how we adopt and adapt to new technologies and adapt to that change. So some of the other perspectives that you'll also want to consider is thinking about today ourselves as consumers and our experiences as those consumers. And we have very connected mobile experiences that tell us where things are, where our family, our friends, our colleagues are, that have home devices that are listening, awaiting our instructions, and they're all connected to our mobile devices and all providing very personally relevant information based on what you're looking for, based on what you're wanting to check on. And this is the world that we live in as consumers, and it is disrupting businesses, it's disrupting enterprises and government, and it's disrupting healthcare organisations with that expectation from a consumer perspective. So if I now then just pivot more particularly to the healthcare spectrum and thinking about the last couple of years, in particular here in Australia, particularly this year and some trying times that we've had through the pandemic, we've seen that whilst we've been working with healthcare organisations for more than 20 years around the globe, that there's been no business, healthcare not excluded, that isn't immune to this crisis, and no organisation can be 100% resilient. But what we did find is that organisations who had already embarked on some of their transformation journey were in a position to be able to pivot more quickly, were able to respond more quickly to the customer's needs faster. And that really highlighted resilience for us, the ability to adapt quickly to changing conditions. And it's become one of the hallmarks of success in today's environment. Then you overlay that with what we understand from our care team's perspective, that even with that resiliency, they're struggling with large amounts of patient and customer information. It's often paper-based or potentially in more disparate or disconnected systems that you're wanting to bring together. There are rapidly changing consumer needs, as we've already spoken about, and rapidly changing government needs, of course, throughout the pandemic. And at the same time, being significantly under-resourced, under-staffed, with significant time pressures of where we're needing to, address and meet those needs. So I think we would all agree that it's been tremendous from all of our nursing, medical officer, health staff, government staff, everybody involved, of the ability to be able to continue to serve all of our needs as, from a public's perspective with limited resources. And we've probably also been quite lucky from an Australian perspective, given our impact from a global perspective. I do think that there are still many, many pressures, and I'm sure many of you on the call would agree, when I consider the heightened targets that we have from a double vaccination perspective. I know my understanding is that some states have also put out extreme, even higher targets of where they want to be, so that we're in a position to be able to support those sectors, those those people on the ground to be able to provide a capability and support in a position where we're better able to deal with it, just simply being able to deal with those staff shortages. So then you look at it from right across the entire care continuum. There are multiple challenges there, nevertheless, ones that I've already highlighted. So that's not only just from the patient or the consumer or the client perspective, whether it's from the clinical experience itself or even the healthcare organisation as well. And I think a key factor, which we'll talk to in a moment about this, is that often we look at it from a digitisation perspective. How can we digitise the paper medical record and link those processes and more effectively surface them? But what we do need to consider is that the traditional medical systems, the EMRs and EHRs, the PAS systems, the practice management systems that we've all been very familiar with for many a decade, they weren't designed necessarily for strong amounts of collaboration or communication as systems for engagement. They weren't designed to necessarily provide a lot of insight that can help drive performance improvement, help drive additional patient outcome performance improvement. So it has left us with, even with these systems in place, people still needing to collaborate, to coordinate, to run up and down stairs. I've heard organisations say to me, shuffling paper and taking information from one place to another, and using whatever systems that they can in order to try to work more productively. And I'm sure all of us as patients ourselves, in some form or another, in our own families, you would ask, why would I need to fill in a form with the same information 6 or 7 times? For example, how can I access that information more readily from my GP or my specialist perspective, or a VMO, or a surgeon or a physio-psychiatrist? Why doesn't the technology make my job easier? Why can I not access systems that I want to? Why can I not connect with my colleagues more easily? And from that healthcare organisation's perspective, what if we want to be able to implement new models of care? How can we juggle that with such staff shortages and increasing demands? What are we wanting to augment services such as hospital in the home, or additional services in the community, or expanding our allied health services across our patients or our member base, for example, as well? So all of these areas have been what we've taken these past couple of decades of working with healthcare organisations and brought together under what we can now call the Cloud for Healthcare. So just before we get to that point, I just wanted to point through thinking about digitising your patient record and what that actually produces. And it's a fantastic, amazing aspect to be able to bring to life, to obviously provide a lot more accessibility, provide some level of standardization. But how does that help you, as we've spoken about throughout this discussion, help you more effectively communicate and collaborate? How does that provide the insights for measuring performance even deeper than where you are now? So if you then consider, how can I transform that to systems of insight, information that I can then actually more effectively leverage across the organisation, across any type of user, across any type of medical profession, to help drive more effectiveness, drive more insight, and drive additional performance improvements, and of course, patient outcomes. And then lastly, how can we get to a point that we're actually looking at a system of engagement? Because this is an area that the traditional systems have not been meant to actually fulfill. How can we unlock value from that systems of record? And now this doesn't mean this has to be a rip and replace. It's more of a wrap around your existing systems so that you can pick and choose how those may be impacted in later stages or in later years. You can leverage all of the underlying systems, leverage all of the underlying data and information, and it enables you to extend beyond the walls of your hospital, beyond the walls of your clinic, of your facilities, extend it to your mobile devices and provide deeper levels of services. And I think this is one of the key differences between digitisation and digital transformation, where you're leveraging technology to improve those processes and do things differently. So this is where the context from which we brought together Microsoft Cloud for Healthcare, leveraging 20 years of capabilities, 20 years of servicing healthcare organizations across the globe, and bringing that together in a cohesive, integrated, even templated solution to be able to elevate and escalate and accelerate that amount of transformation that's possible in your business. It enables you to deliver new models of care in these rapidly changing environments that we've been speaking to, whether that be telehealth, precision medicine, hospital in the home and preventative health care, or even chronic disease management and remote monitoring. So it really enables you to deal with a number of particular areas, not only safeguarding the data, empowering both your patients and your staff, enabling you to be able to rapidly change how you work, and supporting those virtual teams, not only just in the four walls, but obviously virtually as well, provide an enterprise-ready, secure and scalable solution to do that, and support different platforms, not just web, but also mobile, of course, and further even adding value when you're leveraging artificial intelligence and IoT integration as well. So those four areas, or three particular distinct components of Cloud for Healthcare, really come together as individualized components. So that's sort of building up a little bit better. Let me just go back to that. Individualized components that you can see outside of the rings here. And these are actually even packaged solutions that are available to be able to download and install. It's made up of the traditional solutions that you're already very familiar with from a Microsoft standpoint, Microsoft 365, including Teams, Microsoft Dynamics 365, and of course, Microsoft Power Platform, which is the low-code, no-code capabilities. And it sits upon a common data model from which you can ingest and bring in additional data from multiple sources, whether that's on-premise or in the cloud. And then obviously leverage a raft of standardized connectors to bring in data into that connected data model to be able to share that and surface that across your different health teams. There are a couple of other even more technical slides here and more detail, which we can obviously go into at any particular time that you're wanting to be able to explore a little bit deeper, because these components, while they are packaged and templated, they're entirely extendable with additional partner IP globally, and they're entirely extensible in terms of you being able to tailor the solutions to be able to fit your requirements, no matter your industry or your particular healthcare requirements, because it's sitting on these core tenets from a Dynamics and Power Platform perspective in Teams. I think from a roadmap perspective, there's been some exciting developments that we're doing and bringing out, for example, around the virtual clinic that integrates the experience right across a Dynamics and Teams and patient portal perspective to really provide a holistic way of replicating a physical waiting room, for example. So that people are in a waiting session in a Teams environment. They're collaborating with the receptionist and the scheduler, being able to converse directly with their GP or their specialist or their doctor, and being able to also use some of the tools that we're even extending even more so around the world that capture notes, that enable you to capture images and notate them on the fly in the middle of a conversation. There are many advantages of what we're already playing out across the globe that extend those capabilities. A raft of partners that you'll be familiar with. And probably actually, I'll just finish up on this next slide before we hand over to Lisa. Just encouraging everyone on the phone and on the call to consider, what does an empowered care patient or customer or consumer journey look like for your clientele, for your end customers and your consumers? I mean, we're all familiar with the journey as our, in our own medical backgrounds, but there are so many touch points and opportunities to not only capture records, but of course to generate insights and provide information to your users, to your specialists, and to your customers right when they need it. So I'm really looking forward to the next discussion points and getting a lot of feedback. And I think there's been quite a number of questions in the chat already, but also handing over to Lisa to talk us through and showcase some of the key capabilities that are out of the box.
Thanks, Mel. That slide is excellent. I'm going to leave that there and talk to that in a minute because it's a really good segue into starting to show the demo, because you'll see there all of the different components that are making up the cloud for healthcare. And I'm going to show you in 20 minutes many of these. So we're going to cover quite a breadth of different topics to give you that high-level view of the different capabilities. And then if you see something in here you'd like to know more about, please pop a question in the chat, or that's something that we can follow up with you. The concept of this, and I can see someone had already asked about aged care in there, for instance, is that you don't have to use all of these things. They're all configurable and can be used in different kinds of scenarios. And there are different components in here, which means you can start with one component and maybe just use that component or add other components later. So I am going to go through quite a lot of these things. I'm going to show you the virtual health bot. We're going to have a look at the patient engagement portal, concept of virtual visits. What else are we going to see? We're going to see personalized patient dashboards, some of the stuff coming back in from a patient wearing a device on her wrist and sending data back to the healthcare team. We're going to look at the patient, the care management and home health. So I'm actually kind of picking out most of the things along the journey there, but just remember, you don't have to take all of this. You don't have to use all of it. These are all components that can be used in different ways depending on how you want to do that in your organization, or to start somewhere and grow over time. All right, I'm going to grab the screen if that's okay, Mel. And so here's what I'm going to show you as we go through the demonstration here today. We've got two scenarios. We're going to spend most of the time on this first one, which is around enhancing patient engagement. This is all about personalized care insights, virtual health. So we're going to be looking here at a patient who is working through a portal, interacting with a bot, and we're going to see both sides of that experience, right through to having an appointment, booking an appointment and having an appointment. And then we're going to have a look at what happens from the health care team collaboration side of things, the way that they can coordinate and collaborate and monitor those patient signals that are coming through. Patty is our patient for today. Our starting point here is that she's already a patient of Contoso Healthcare. She's been a patient for a long time. She has a login set up for a portal. She's agreed to wear a device to help with sending data through to her healthcare team, and we'll see how that works. We've got Mattia at the Contoso Health side, who's our care provider agent, who's going to be coordinating a whole lot of stuff, and we'll also see some of the broader reach into the Contoso Healthcare team. So to get started here with how we use this to enhance patient engagement, our first scenario here is that Patty, she's a runner, she's a very active woman, but she's twisted her knee while she's out running. So rather than taking herself off to the ER, to the emergency room, not fun for anyone, especially right now, she's actually going to reach out to her healthcare provider and be able to get that guidance there. We're going to see that she will interact with a chatbot and ask to speak to a healthcare professional. And then on the other side, on the Contoso Health side, we'll see that a nurse practitioner who's triaging those calls can actually work through those, accept the call, look at her full patient record, get some knowledge base information from the system and send her some information. We're then going to have a look at the experience of Patty when she's made that appointment, she misses the appointment, and how we communicate with her through the tools in the cloud to help her schedule a new appointment, which she goes ahead and does through the portal. So let's have a look at how all of those pieces come together here. So we're starting with the portal, which is a secure sign-in experience. And there are different ways of enabling that depending on what you want to do for your organization. We're using here the Azure AD B2C experience. So Patty already has that login set up and she can come in here, put in her username and password and sign into that secure portal. Now, everything we see coming through on the portal here is actually sitting in the system underneath. And what we're going to see as we go through, I'm showing you the patient experience first, and then we're going to switch across to that Contoso Health view, and they'll be able to see that you're seeing the same thing from the front end. And this is all securely sent out to Patty as she logs in so that she can manage her profile, for instance. So we'll see here as she logs into the portal that she's got the ability to do things like finding a doctor. So we can go in and she can do this kind of self-help thing. Who's available and where are they available? Back on the main home screen here, we've got the ability to schedule appointments. She can receive messages securely through the portal again from her healthcare team, as well as that find a doctor that we just saw there. You can see we've got on the front screen there also the ability to see her medical records, so she can go in and get an overview of the medical records and the different appointments and things that she's got coming up. So all of that's managed in there. And she can also update her personal information, so anything about her emergency contact details and so on. So that ability to go in and update her profile, taking some of that administrative work off the healthcare team. We've also got healthcare coverage in there, the details of her current policy. And when we go back into seeing this from the side of the healthcare team, we'll see all of those things in the database and where they're coming from. So as we said, Patty has hurt her knee while she's out running. So what she's going to do, logged into the portal here, is she's going to instigate a chat. Now this starts with a Contoso healthcare bot. The idea of using a bot is that it can help with some of the more routine tasks, and it can also seamlessly escalate to a real person, which is what we're going to see here. So the bot is very good at being able to answer standard questions and answers. We can use it to find the right person for her to connect with. We can use it to schedule appointments and things like that as well. So she starts off with the bot. She tells the bot that she has twisted her knee when running, and the bot then goes ahead and offers what would she like to do next. Would she like to book an appointment, speak to a specialist or something else? And she says, yes, I'd like to speak to someone, please. So we've got that seamless experience here where the bot is now going to get the critical details so that it can identify who she is. She's securely logged in, remember, so that when this is escalated through to the agent on the other side, who's a nurse practitioner who's going to be triaging this call, that's immediately going to bring up Patty's medical record in context so that that nurse has all that information and also has all of this chat. So the bot is doing that first thing. So we switch across now here. We've got the nurse receiving this chat request from the chatbot. And what we'll see here as we go in is all of the chat down the side here. So this is everything that we just saw from the chatbot on the website. And because we know who Patty is and it's logged in and authenticated her, we've got her full patient record. Now we're going to have a look at the full patient record in a little bit more detail as we go in. So you'll see this screen appear a couple of different times, but in context here, what we have is the chat down the side. We've got various tabs here that allow us to see what's going on. We've got all of her summary information and some activity here. And so the nurse has got all of that information available. We've also got a knowledge search on the side here. So what we can do is to say, okay, she's reviewed that information, but we're going to find out what information we can provide to someone in this circumstance who's got a twisted knee. So she can go ahead there and search for that and use that knowledge base to bring up the information about what should be done, and we can view that information, and then she can engage in the chat back with Patty on that. Or as we'll see here, we can actually go and say, do you know what, let's send all of that to her and do a quick copy paste and get all of that out to her. Now, at this point, you'll notice in the chat, we're also detecting sentiment here. The sentiment is neutral. So we've got live sentiment, so we can detect that within the system. We come back to Patty. Patty receives all of that information. That's helpful for her. She knows what she needs to do, and she can start to take the right actions without needing to do anything. She's happy with that situation. We come back here and we see that again, that's come through to the nurse, and you'll see the sentiment now has changed to slightly positive. So it's detecting that all the way along there. So Patty has been able to log into her portal. She's managed all her information. She's gone ahead and got that. So now we're going to come in and have a look from a more holistic point of view at what's going on underneath here. So this is our point of view from the Contoso Health Care staff. So they've got a dashboard seeing all of these different things, and we've got all the patient records in here. And this is bringing together a lot of information, as Mel was saying, from all of those different systems, providing a situation here where we've got that cohesive healthcare picture of the person, of each patient. So to start with, we've got a global search at the top here, which makes it easy to go in and find the person. So I'm now Mattia in here. I'm going in and searching for Patty, and this is the record that we just saw earlier when the nurse was looking at it, but we're getting the full picture here. So we'll just take a moment. We've got all of her details down the side. We've actually got some insights in here as well. So once we start to bring all of this data together from all of these different sources, we can enable these insights to appear in context. So here's a reminder, here's a notification of something that the system is suggesting that we need to take action on for Patty. We've got some information here from her wristband that she's wearing, about her current conditions, beautiful visualizations in here that make it really quick and easy to see what's going on, timeline of all of the different activities that we've had with her, the different communications and things, so that we can track all of those in there, and also the relationships that she has, the other members of her family, or points of next contact in there as well. And you'll remember that we saw some of these things on the portal when she could go in and manage her profile. That's where this is coming from. So when she's logged in there, if she's managing her profile, it's going to directly update back in here in that self-service scenario. We've also got a view of her full care team here, so we can see everybody else who is involved in working with her. Again, that overview as a practitioner within Contoso Health, I've got a good sense here of all of the different care teams that are working with her and the different people that are working with her, so that as I'm doing that, we've got that context. Now down the side here, in addition to her conditions, we also have some other things. We've got her medication history requests in there. We've got some history of her appointments. We've also got her procedures and what's going on there, any allergies or intolerances that she suffers from, as well as these things that we saw on the portal there as well, coming through where she's got claims or coverage with her healthcare insurance provider. So let's zone in on the appointments here, and we can see what's going on is this first appointment for her annual checkup, she was a no-show. So for whatever reason, she wasn't able to make it. So what happens here is we've got a fully connected marketing system which can do automated triggered communications. So this is switching across now to that experience, just to show you what it looks like. No one actually has to trigger anything here because this is all automatically set up. So when she misses that appointment, she gets dropped into a segment of people who've missed appointment, and this journey kicks off for her. So each time someone misses an appointment, they'd be dropped into this journey and they'd get this same series of email communications. So the first thing that happens here, she is a member of this missed appointments thing, is that it sends out an email to her saying, look, you've missed an appointment. You'll see there in the journey, it actually waits for 7 days and then sends another reminder. So we're doing that proactive automated communication, and this goes out to her. So she'll receive this information, and from there she's able to click through and go into the patient portal, which we saw earlier. Again, securely logged in here, and she can choose to make another appointment, and she can go through the choices here about whether it's virtual or virtual or in person, choose the reason, choose the clinic that she wants to go to, and also to choose the appointment time there. Now don't worry that we've got some early hours of the morning. That's my browser my browser converting some times from an American time zone in a slightly creative way. So she's chosen that 8 a.m. appointment, and then she's got her information in there for confirmation of that appointment, and she can go ahead and schedule that. So all of those self-scheduling things there, you'll see once she has confirmed that appointment that she's also got really easy access there to cancel or reschedule that at any time. So again, we're really taking a lot of administrative load off the team. So that wraps up that first scenario there, where we're looking at how we can improve that engagement with patients, with that self-service experience, that full 360-degree view of the patient, the view of the care team, all of those things that are going on, and marketing journeys that can trigger out automated communications, reminders, or whatever else you need. So now we come to the care team experience where we want to do some collaboration on things. And what we're looking at here is the experience of empowering that health team collaboration. So Patty now has made that virtual appointment. She's going to do that appointment with her doctor over Teams. And we'll also see how the Contoso healthcare team is working collaboratively to support Patty. She's actually been sent home after surgery to recover at home, and so how they can stay in touch with her and collaborate with her through that process. We'll see that the care team can also manage their shifts in here. This is coming from a third-party system, but we're bringing that into the flow of their work, and how the care team is reviewing Patty's progress after she has been discharged through that smart device that she is wearing. And finally, then we'll see that a physical therapist makes a home visit, and we'll see how the system can be used to set up care, plan goals and activities. So let's just switch back in and see where we are here. So you'll recognise, hopefully this is Microsoft Teams now that we're in, and there is Patty's record again, slightly different view this time, but we can bring that in here. So now we have the experience of the doctor making the call, and because Patty consults with a lot of different practitioners across Contoso Health, we've got all of that information available to us. We've got information from the EMR, we've got information from the different practitioners, which allows them all to really work with that holistic care instead of the doctor only being able to have a view of what they've done. So we've got information here about various other appointments and conditions and things there. So the doctor is working in Teams, he's doing the virtual call here. So we've got this meet capability, which is the standard thing you would use for Teams, and we've got the context of that record throughout that meeting. I won't try and attempt to do a virtual meeting while we're doing a virtual call here, but I'm sure you've seen Teams meetings many times. You get the idea. So from there, what we can do is see this collaboration where we see Patty has now had her surgery. These are some images of her knee post-op, and the team is doing their rounds. They're doing virtual rounds here for Patty because we're actually sending her out onto the, to home for the home care, and we can collaborate in Teams here. So we'll see that the team is able to collaborate in there and communicate about what's going on and the next step. We've also got shifts in here. So we've got the ability for the team to have view of their shifts of what's going on and go in, and you'll see there's the offer there to offer or swap a shift. So that's all coming in from that third-party system, but it's bringing it into the flow of work. So using Teams here, and Teams is becoming a really increasingly important part of collaboration across the scenario here, where we're bringing all of that in the context of doing those virtual telehealth appointments and so on, and being able to collaborate with the team along the way there. All right, so we're back into our patient record, and we're going to have a little bit more of a look now because the healthcare team has worked with her. We've got all of these activities here from her wristband pre-operation, and we can see what's going on there and how that's working. And then we can compare that to say, okay, well, now that she's recovering at home post-op, how are those things going, and what are her vital statistics and information that are coming through on her activity levels against goals and so on, and really monitor that and keep track of how she's going with her care at home post-operation. From there now we have a physical therapist who's making a home visit, and we can see here that we've got a care plan. So in addition to the care team we saw earlier, we've got the full care plan of what's going on with the different parts of Contoso, and from there we've also got the ability to see the different goals and activities that we're setting against that care plan. So we can see we've got those 3 different care plans in place. We've got a series of different activities that are associated with those, and a system here that allows us to set up those goals and to view what's going on across the board there. So you'll see here we can see that we've got for that care plan this stage 1 goal for the first 2 weeks, and here are the different activities with that. We've got an activity related to her diet there. We can keep track of all of that in there and continue to review those things as we go along. So that's our second scenario there about empowering health team collaboration. We've seen how you can use that in Teams, how the team can view that information in the context of a call, collaborate together on what's going on, viewing all of the information about what's happening with her metrics coming through from her wristband to assist with in-home care or post-operative care, as well as setting up care plan goals and activities there across the team.